So I think it's really, really important that for the next stage, which is Act Two, that you really, really focus on role playing what it is that we do. Again, like I said before, it's not just about hearing what I tell you or watching me on this video. The real learning is going to happen when you do this thing. And I think it's probably a better idea to actually do it now between you and somebody you trust, as opposed to wait until do it right on the telephone. Because then what might happen is your nerves might take over, and you might just simply go back to the way you normally do things. So I think it's really, really important to practice this. How many times? Probably 20, to be honest. The kinds of things that I feel get to the point where they're almost like you don't even think about it. They take 20, 30, 50, 100 times of practice. If you can do it as many times as you possibly can, you'll get to the point where it becomes a lot more natural and free-flowing for you. You'll start worrying less about the process and focus more on listening to the patient as they talk to you. But anyway, let's continue with the actual process of opening up the patient so that you can get to the next step. So the opening. Well, the opening is all about asking questions. And as I said to you before, questions are the key in engaging patients and leads on the telephone in order to open them up so that they are ready to follow your instructions, which include, please come and see us for an appointment. So why do we ask questions? Well, we ask 10 questions specifically. We have, like I said before, worked for almost a decade now on trying to understand what specific questions work best. This is not a process that took a couple of weeks to put together. This is a process that has the benefit of over 10 years of practice and development, and used among many, many different people with lots of different feedback coming back to us to make sure that we're addressing and evolving the process to fit our needs today. I'm also going to introduce you to a concept called the motivation tree. And the motivation tree is an excellent model to help you understand what it is that we're trying to achieve, what we're hoping to understand from the patient by asking them these 10 questions. So where do these questions come from? Well, like I said, we've been continuously developing these questions since 2003, really. We have been adding and removing questions to the list. Like I said, we only started with 3, and we're now up to 10. We've been refining the order of the questions that we ask. So sometimes we have realized, well, we should really ask question number 7 a little later because it makes more sense, or patients respond better when we do this. We have also been considering every word, every emphasis to make sure that the question clusters are appropriate and that they make sense in a variety of different circumstances and remain engaging and communicative so that patients actually hear what it is we want them to hear and answer questions efficiently. We've been helping to make them easier to ask and also easier to answer. How we've done this is because one of the things that we do is we listen to telephone calls, hundreds and hundreds and hundreds of these telephone calls, and evaluate them on the basis of our process. When we do that, we're able to detect the distinctions between people who ask these questions appropriately and get the answers that they're looking for versus people who don't ask the right questions and don't get the answers that we need. We have also been able to verify these improvements that we've made to the question set with lots and lots of experience, like I said, over 10 years. The results of people who apply this process actually increase in their conversion rate. We're able to determine a very, very strong correlation between people who adopt the process, who follow our instructions, and then who turn out to, in fact, improve their results. We can determine before and after scenarios in order to determine whether or not our process is making any effect. And in the situations where we have determined that results have been better, we have also then been able to examine that more closely so that we can ask the questions just that way so that we can improve our question set better. Now, the the discovery tree is what you're looking at now. That is a model that takes on a whole bunch of different distinctions and puts them into one diagram. Essentially, it starts off with the phone call, and we have 10 distinctions in that model. One of them is the first one is the problem, where we ask the person what is the problem that they're having. The second one is the past area, and what we're asking for there is something that I refer to as the past motivating incident that identifies the pain that the person has, the reason why they're calling, the main driver behind what's happened in the past to encourage them to call us today. We also then want to ask them a little bit about the future in terms of what solution they're seeking. That's number 3. Number 4 is asking a little bit more information around what future motivating event is compelling them to make this phone call now, so that we can use that information in leveraging their urgency. All of this together, if you like, is the essence of the emotional components of the questions. Question 1 through 4 are all emotional. We start with emotions first, and then we follow up with more objective questions, starting with number 5, which is qualifying. What we want to know there is what kinds of things have they done in the past to solve this problem, so that we can understand how we might do things differently. Number 6 is all about priorities, understanding the key things that they're looking for in a provider, their must-have list, if you will, so that we can truly understand how we fit with their priority list. Number 7 is their criteria, so that we use this question cluster to understand more about the different things on their shopping list that are nice to have. They might not be the most absolutely important things that they must have in a transaction to take place, but they are useful nonetheless. Number 8 is the decision maker, where we ask about who else is involved in making this decision with them and identify what influence they have, and to see whether or not we need to invite them to an appointment. And number 9 is the deadline, meaning when do they want everything solved by? When is the point in time in the future that is probably related to the future motivating event? When do they want it all done by? And number 10 is the timing, which relates to when do they want to get started? When is the step, or when do they want to take the next step, if you will? And that next step in the context of the phone call is booking the appointment. So we finish with that because, again, we want to focus on issues that are most relevant to the subject matter we're talking about at the very beginning, which is the problem, and at the very end, which is the timing in which they'll have that problem solved. So that's the whole discovery tree, which I'll be alluding to over the next sections where I discuss the Act 2, which is the opening.